And thank you for coming to our forum to discuss substance abuse services in Rutland County, sponsored by Recovery House, Inc. My name is Dave Allaire. I am a board member of Recovery House, and I will be serving as your moderator here tonight. My job will be to introduce our speakers, to keep things moving along. I will moderate a question and answer opportunity from the audience after our speakers. And finally, we will have a presentation of the Community Partners Award. We know there are many more organizations and people working to combat substance abuse in this area. We selected a small number of providers so that we can have a forum that allows each provider some time to describe their services and allows for a question and answer session following the presentations. Recovery House deeply appreciates the efforts of each and every provider and person involved in this effort. We applaud the efforts of all, and we realize that it takes a community to fight back against the epidemic that we have and are experiencing. So to begin tonight, it's my pleasure to introduce our CEO, Dale Robb, to say a few words to begin tonight's program. Dale.
Thank you, David. David is a member of the board of directors of Recovery House Incorporated and has long-term family ties to the organization. His mom ran our treatment facility for, I think, about 22 years. So she touched a lot of people in this area, and we loved her very much, David.
Thank you.
She was a help to everyone.
Thank you.
And I want to especially thank some of the people that are sitting in the back left-hand side, because they are people who currently are participating in some of the services that we offer. And we talk a lot in treatment about recovery being something where an individual builds community supports and where you strive to develop some kind of social connectedness. And guys, this is part of it. This is what you do. You get involved, you come to these types of things, and every time that you contribute and give, you get stronger. There are people here from various organizations that I see and recognize, including Recovery House. I thank all of you for coming. And I want to take a second to thank the College of St. Joseph's. They have generously provided us with this space to do this. It's not the first time that they've done it. They gave us this same space a couple years ago for a substance abuse forum. They've done it for many different organizations. I had Bernie Sanders here for community meetings back when Bernie wasn't a presidential candidate, but he was simply our congressman. And they gave us the space for us to be able to do that too. The College of St. Joseph's has played a huge role in my life. I have a bachelor's degree from this organization. I have a master's degree from this organization, and I teach here. I have the academic rank of assistant professor, and that all came from one day I was driving by and thought maybe it'd be a good idea if I went to college. I stopped in and I left, and I think I had 4 student loan applications. So you got to be careful. There's 2 sides to the coin. But this is a college where they say yes. It's an environment that is supportive. It is an environment that provides a tremendous amount of financial resource to the students that go here. It is an environment where I can speak mostly about the Human Services Department. It's the department I'm most familiar with, but it's an empowering department. It's a department that has a lot of adjunct faculty so that students who come here are learning from people that are actually practicing in the field right now. They have a high level of expertise. They participate in the community that they are located in. And I'm very grateful that they have let us come here tonight and use their facility. So David, having said that, back to you.
So thank you very much. Thank you, Dale. So I just would like to go through the speakers that we have here for tonight who are going to be making presentations, and then we will get started. We have with us tonight Clay Gilbert, who is the Director of Evergreen Substance Abuse Services. We also have Sarah Roy from the Vermont Department of Health, who is the Rutland County Substance Abuse Prevention Consultant for the Office of Alcohol and Drug Abuse Programs. We have Faye Stone from the Westridge Clinic. She is the director. Sarah Narkewicz, Director of Community Health Improvement at the Rutland Regional Medical Center. We have Sue Daly, drug and alcohol counselor doing screening, brief intervention, and referral to treatment for the Rutland Regional Medical Center. And as you've just heard, Dale Robb-CEO of Recovery House. Thank you all for coming. We appreciate you being a part of this. Thank you. So why don't we get right to it? And our first speaker tonight will be Clay Gilbert. Clay.
Thank you, David. And I'd like to mention that in 1986, I was a client at Serenity House, and that's when your mother was the director there, and she certainly helped support and get my recovery on the right track. Like I said, my name's Clay Gilbert. I work for Rutland Mental Health, which is part of the Community Care Network, and I'm the director of Evergreen Substance Abuse Services and the adult outpatient program also that treats folks and helps support people with mental health problems. Just to briefly go over the substance abuse services that we have, and we have a lot of different small programs. I actually have more programs than I have staff. But the first thing that we have to do when someone calls and looking for help and looking for services and for a variety of reasons is we set them up with an appointment, of course. We have to do an assessment because we have to figure out, okay, what's going on with this person? You know, what's your drugs of choice? What are your issues? What level of care do you need? That sort of thing. Most of the people that come in, we can handle in our facility. Occasionally, someone comes in and I find out that they're shaking, they're detoxing, and we may have to refer them to detox or residential care. But most of the people that come in, we can deal with. Our highest level of care is intensive outpatient, and the nickname for that is quitting time. Some of you may have heard of it. What it is, we have a morning program and an evening program, because the idea is for people to have a high level of care and still be able to participate in their life, if they're working or they have children or going to school or whatever the case might be. So the morning program is 5 mornings a week, evening program is 4 nights a week, and that's 3 hours a day, and it consists of psychoeducation, group therapy, individual counseling, urine drug screening, all that sort of stuff. And it really helps them build a foundation for their recovery. And we also have a co-occurring IOP, which we recently started this last year, and that's only 3 days a week. Because quite often people with co-occurring issues, they might progress a little slower, so we like to kind of pace it a little slower, and it works with both their substance abuse issues and their mental health issues, because quite often they work together. If someone does well in that, or when they come in, if they don't need that level of care, we may have individual counseling, we may have case management for the person, maybe the person's homeless or needs a job or whatever, so we help organize those things. We also have a lot of groups. We find that groups is generally the most effective mode of treatment for people with substance abuse problems, especially in a small community, because everybody knows everybody here and around in this community, and when people try to weave stories or tell us how clean and sober they are in a group that may not quite be true, quite often someone will call them out on it, and that's very effective. We have a lot of specialty groups. We have men's group for, of course, people with men, because the men have particular issues that have to do with their recovery. What's their role going to be in their family now that they're clean and sober? And we have a women's group. We have a co-occurring group that meets once a week for people with both substance abuse and mental health problems. We have a relapse prevention group, life skills group. We have some evening groups. We have some morning groups, daytime groups. So we try to have a menu of things that fit the person's needs and the person's particular schedule. We also do all the case management for the Rutland County Drug Court. Now, for those who don't know maybe much about drug court, I found it's one of the most effective interventions that there is. Because, a lot of people, quite often people need some sort of a nudge, and a nudge from the judge to straighten your life out is quite often quite effective. And it works the best. What it's for is people who have picked up a criminal charge, but it has something to do with their substance abuse. Maybe they got caught with possession. Maybe they got caught stealing from Walmart or wherever to sell the stuff to support their habit, whatever the case might be. So then, if it's approved by the state's attorney and the defense, there's certain legal criteria, like we don't take violent offenses and that sort of thing. But they could be eligible for drug court. And drug court is a very intensive program with both graduated sanctions and incentives. When people come in, the first thing they do, of course, is get an assessment. They have to go to certain levels of care, follow their treatment plan, get regular urine drug screens and that sort of thing. And if they do well, they work through the phases of the program. And along the way, if they're doing real well, they may get some incentives like a gas card or a $5 coffee card or that sort of thing, just to kind of give them a little encouragement to keep going on. But if they're not doing the right thing, well, then they may receive a sanction. A sanction could be anything from sitting for an afternoon in the jury box, in a courtroom to watch the proceedings, writing an essay of apology, that sort of thing, maybe doing some community service, or even a night or two in jail if they stopped one of their groups or they didn't follow through on whatever their treatment plan was, or they weren't supposed to be somewhere and that sort of thing, then there might be a sanction. So between the sanctions and the incentives, it helps with behavior modification. It's really a really good way of looking at behavior modification. And people go through the program, and if they're successful, when they get to the end and they graduate, several different things can happen depending on their criminal history and the severity of their charges. It could be that their charges just go away and get expunged, which, particularly if it's someone with their first charge, it's really a great opportunity for them to get their life back on track, because then they're still eligible for college or certain vocations or the military or whatever the case might be. Maybe if it's a little more serious or they have a long criminal history, instead of going to jail and doing jail time, they're just put on probation. So there's a big incentive for them to do well in the program. And it lasts anywhere from 9 to 12 months. So there's a long period of time that someone really has to kind of keep on the straight and narrow to put their life together. And it really gives them a good foundation to start moving forward. We also do the facilitation with the federal drug court, which is very similar. It's just for federal charges. Some of the other things that we do, we have a case manager that works in the reach-up office. Now, the idea is that reach-up is a program facilitated by the state to help people become employable and get jobs. And the thought was, gee, maybe some of our folks aren't becoming employed because of a substance abuse problem, which I thought was actually a pretty good idea. So we have a case manager embedded in ReachUp, and if someone is identified that they could have a substance abuse problem, they're referred in, they're screened, we do an assessment, and we help them get on the road to recovery, and quite often these folks then become very employable within a short length of time. We work a lot with DCF. A lot of folks get in trouble with custody of their children. I'm sure many of you are aware of those type of cases. And quite often they're very sad, but they also quite often have to do with substance abuse. So we help people with either reunification or get their life on track so that they don't lose custody of their children. A relatively new program that we have is working with the elders. Now with the baby boomers, which unfortunately I'm one of those now, are starting to get older. And a lot of these folks they're having substance abuse problems, but they're very different than the alcoholics and addicts that people normally think of. Quite often they're quite isolated. They're very lonely. They really don't get out much. Maybe they've lost their spouse. Maybe they're not working and their career's ended, so they don't know what to do with their time. They're quite often, as they get older, they're on several medications. And as the body gets older, it doesn't handle alcohol like it used to. Maybe when they were 40, 2 glasses of wine in the evening was fine. But now that they're 75, 2 glasses of wine with 6 different medications isn't so fine. So as those are being identified, we have a person that actually goes to their home and does an assessment with them and does counseling right in their home. Because a lot of these folks, they have, for a lot of reasons, they may not have the transportation or even the physical ability to get out, or just feel embarrassed. But quite often, particularly because they're lonely, quite often they're glad to welcome someone in their home to help support them and get well. The last thing I'll mention is that program that we have at Evergreen is Project Crash. And that is a program for those that have had a drinking and driving problem. And it's a state mandated program that people have to go through. And it's 4 sessions. It's an educational program that people have to complete. And depending on how many DWIs they've had and how high their blood alcohol was, they may have to do additional counseling. But we facilitate that so to help people get their license back. I think that's all I have for right now. But I do want to say thank you to College of St. Joseph for hosting this. And I really want to thank Dale and Recovery House for putting this together. And thanks for inviting me. I appreciate it.
So thank you very much, Clay. We appreciate that. Next up, we have from the Vermont Department of Health, Sarah Roy. Sarah.
Thank you. So my name is Sarah Roy. I work for the Department of Health Alcohol and Drug Abuse Programs. I say that I do work in public health as it relates to substance abuse. So Dale really wanted me to touch upon, we have a very new, finally interactive website that doesn't look like a state website anymore. As you can see, it has a nice scrolling body at the top. It actually has different places where people can click on to find information. On the left-hand side, it tells you exactly what you can look for. Oh, thank you. Feel free to put the little cursor, slide it right down all of them if you would like. So we have alcohol and drug abuse, children, youth, and families, health and the environment, health promotion and chronic disease, immunizations, access to where our local health offices are, public health lab, vital records, and health professionals and systems, and even news and information, and more about us. So it's a great website, very interactive. There's many different topic areas. The pictures that you can see on the front, they actually are different with smokers and ex-smokers, new Vermonters, local officials, expecting parents, parents and caregivers. Keep going, one more. Community partners, health professionals, school professionals, and then one specifically for alcohol and drug users. So it's a great way to get information out. It's more interactive. If you can click to the next tab, please. One of the other pieces that we put on our website, we look at our data. So what is our data telling us in the state? So one of them that's just open right here is percent of persons age 12 and older who need and do not receive alcohol treatment. So what we're trying to do is actually show people where we are and where we've moved to. So it's a smaller graph, but you can actually see where we've changed from 2013 to 2005. And this is looking at our National Survey on Drug Use and Health. There's many pieces of data on our website, and we're highly encouraging people to go and explore, see what we have access to. In the past, we used to hold the data and wait for you to ask for it. Now we're putting it everywhere. Put it up here so people can access it and go and use it so it's useful information for people. And the last one I wanted to point out is the last one. People always want to know, where are we as far as our hub and spoke providers, so people that provide Suboxone and methadone treatment. And this just gives a breakdown, again, accessible on our website, and tells you where our wait lists are, the number of people receiving treatment currently. These are snapshot pictures. So as of the day that this was published, that was it. And this was back in January, so we haven't had an updated one as of yet. And you can see they consider Bennington part of our Rutland County area, and you can look at our line for right now. Number waiting, we had this discussion about wait lists, and probably Faith will talk about it. 0 is not necessarily a number we like to talk about, but if there's a 0 wait list, it doesn't necessarily mean you call tomorrow and you're in tomorrow. There's still a process to go through. So it's just great information. So thank you to my IT helpers. On the table, as you came in, we actually produce what's called the Alcohol and Drug Abuse Programs Overview, and it goes through prevention, treatment, intervention, and recovery. What we spend in the state, how much it costs per person, and how many people are actually impacted by it. This is a document that was started to be created 2 years ago, so it's wonderful. It gives you what we're doing and how we're impacting. Since I come from the prevention field, I like to highlight that We touched 4 prevention services in the last year, 406,404 people. There's 660,000 people in the state of Vermont. So we touched over 400,000 of them with our prevention services. I love to highlight that piece because it does. Prevention is something that can go across all spectrum to it. There's also another one that shows you the breadth of where our services are. We have funding that goes into our school system, so the substance abuse services grants that provide a student assistance professional in some of our schools, funding to the recovery centers, the screening, brief intervention, and referral to treatment, which Sue is going to talk about. Clay mentioned the Project Crash, which is where we have funding as well. Community coalitions, and then I love it because Clay was my perfect segue. Vermont's Most Dangerous Leftovers is a huge campaign we're doing around prescription drugs that people are leaving that are expired, out of date, that they need to get rid of. So we have huge campaigns around that, and we specifically target people who are 65 and older that might just hold on to things that they don't need anymore. We've actually increased our number of locations in the county that have permanent prescription drug drop boxes. We have one at Fairhaven Police Department, Castleton Police Department, Rutland County Sheriff's Department, and Rutland Pharmacy currently. We're looking to actually expand hopefully into the Brandon area, and Green Mountain College is actually going to do their own Take Back Day in April. So that's another piece. And the Parent Up campaign, which is showing parents that they are the #1 reason that kids don't use. So if a parent is expressing interest, talking to their kids, that's a #1 reason that a child won't use. Great information and resources. I'm trying to think if there's anything else that I was thinking of. There's just a lot. I cover specifically Rutland and Addison County, and I have 9 other counterparts that cover the rest of the state. My title is Substance Abuse Prevention, but we cover the full spectrum now because you can't talk about prevention without talking about treatment, recovery, intervention. They all wrap around together, and it's great to be on a panel with people that I've been working with for almost 15 years now. So thank you.
Okay, great. Thank you very much, Sarah. That was great information. So next up, we would like to welcome, if we could, the director of the Westridge Clinic, Faith Stone. Faith. Pleasure to meet you.
Thank you. So, good evening. I am Faith Stone. I am the director of the program director of Westridge Clinic. I'm fairly new in the role since August, but I've been with Westridge since its opening in 2013. I'd like to thank Recovery House for inviting me here this evening to talk about our program. So we are a program of Rutland Regional Medical Center. We are a medicated assisted treatment program, and we are serving individuals who have a primary diagnosis of opiate dependence. We offer daily dosing. We are treating folks with methadone, buprenorphine, and more recently we have patients on Vivitrol. We have 420 patients currently. And just to give you some numbers, we have 290 patients on methadone, 111 on buprenorphine, and 5 patients on Vivitrol. So besides the medication, we also attempt to support folks both psychologically and socially. So we have 8 clinicians at our center. They work with patients. Patients are expected to do one-to-one counseling, group therapy, and also educational classes that focus on nutrition and wellness, how opiates affect the brain, and infectious disease and infectious disease prevention. So being a patient at Westridge, it's a huge commitment. It's especially difficult for folks that have families, are employed, and have other barriers, transportation, financial. Currently, of the 420 patients that we have, 205 of them are employed. So that's, I think, a pretty good number. And I don't have the exact number, but I believe the majority of those folks became employed once being stable with Westridge. In the expectation of patients being compliant with treatment, we find that there are patients that just aren't ready for treatment and at some point leave our program. Right now, of the 420 patients that we have, 49 of those patients were discharged for noncompliance with treatment and have returned to us 3 months after their discharge. We also have 37 patients that have graduated our program and moved on to spoke services. So for patients who have been able to demonstrate some stability in treatment, patients can earn take-home medications. So anywhere from 1 to 27 take-homes within a 2-year period. And that's complete stability in treatment. Negative urinalysis, attending all of their counseling sessions, attending all of their group therapies. And so right now we currently have 71 patients receiving take-home medications. And while we have processes in place to ensure that they're taking their medications as prescribed, it does offer them some freedoms to live life, go about their lives, enjoy their families, work. For our patients that are employed, we do our best to accommodate them. The first half an hour of our daily dosing is dedicated to folks that are employed. They can come in between 6 and 6:30 and get dosed so that they can take their medication and get off to work. We also offer 1 day a week where we're open till 6 p.m. Patients are able to come in after work, engage in their counseling, and engage in groups. And I also wanted to mention the MAT PDOA grant, which is the medication-assisted treatment, prescription drug, and opiate grant that was awarded to Westridge about 1.5 years ago. That grant aims to target folks, especially high-risk folks, to give them access to treatment. So we have a grant coordinator who reaches out to Department of Children and Families, to the Department of Corrections, is working with Marble Valley Regional Correctional Facility with folks trying to get them Vivitrol shots before they leave the facility, and then follow up with Westridge. There's currently 55 people enrolled in that grant. Those folks get assistance with access to treatment, whether it be at Westridge or whether it be at a spoke office. There's also incentives for completing pieces of that program, phone cards, gas cards, and then there's also some other treatment that folks otherwise may not be able to engage in, like rock climbing and acupuncture. So that's been a great program. I think that's all I have. Thank you.
Great. Okay, that was some terrific information. So thank you very much. Next up, I would like to welcome from the Rutland Regional Medical Center, Sarah Narkewicz. Sarah.
Welcome. It's so great to have you all out here on this beautiful night. Feels more like spring than middle of the winter. As I was introduced, yes, I am the Director of Community Health Improvement. And what that means is I oversee kind of two different subsets of work. One is the Bouse Health Trust, which is the hospital's grant funding operations, and I've been involved with that for 20 years. It's a great opportunity for me to be able to work with community partners who are out there trying to provide programs to improve the health of those who live in the Rutland area. And the other is being the Blueprint Project Manager for the Rutland Hospital Service Area. Took on that role about 7 or 8 years ago. And when Dale approached me to speak tonight, he asked if I would address the determinants of health. As this is a foundation of information that kind of gives us a barometer of how we're doing in improving health across the community. And as we know, substance abuse is one of those metrics that many communities across America struggle with. And we have done some great work here in Rutland in the last 5 years for sure in providing more supports and services. My relationship with Recovery House, Serenity House, is dual-fold. The Bouse Health Trust did provide some grant funding for them to start up their medication-assisted treatment program, so that's great. But also some of the funding that comes through the state, through the Blueprint, supports them in having an additional nurse and social worker to help those patients that they're providing the service to. So on to the determinants of health. All right, so that's why I have this slide, because it'd be really hard for me to talk about all the details here. And what I want you to focus on is right here, health behaviors. When we look at all the things that impact our health, health behaviors account for 30% of what determines our health status. And we're talking about tobacco use, diet and exercise, drug and alcohol use, and sexual activity. Things we do every day. Then we move down to clinical care, access to care, quality of that care. That only influences about 20% of how healthy we are as an individual and or a community. So as we have heard from our panelists here, they are providing more access to substance abuse treatment, and they are each providing high quality care. Then we move down into more of the social and economic factors that influence our health, which is level of education someone attains, whether they're employed, and that relates to their level of income, then your family and social supports, and at the bottom is community safety. Project Vision has been focusing on community safety and has really turned the curve on what's happening within Rutland City, and we should be really proud of their work. Then lastly, that gets kind of dropped down here at the bottom, is the physical environment. We live in a beautiful community. We have access to great outdoors to get out and be healthy and be able to enjoy the Vermont environment. We do struggle somewhat in our air quality, believe it or not. We do have some issues there. And then we talk about housing and transit. Houses need to be healthy inside, and people need to be able to feel comfortable, safe, and warm within that house. So this is a national foundation that is used to measure the health status of counties across America. And so it is down here, the County Health Rankings Model, which is funded by the Robert Wood Johnson Foundation, that uses these metrics to then provide to us this next slide. How healthy are we? So here's a picture of Vermont with the health outcomes, which is taking a number of different quality measures, adding them together, and showing us how we compare to our other counties across the state. The good news is we've moved from 12 to 11. Rutland's at 11. And this is indicating our current health. Now, looking forward to the future, it's weighted scores across the determinants of health, all those things I just talked about. We're moving up into the blue. We're number 9. This is predicting our future. So I think that's a really positive thing, is as we're looking forward, we're making great progress, and moving from the darker color into a lighter area. You can look at all of the data. Sarah talked about data, and by going to the county health rankings and break out, tobacco use and the sexual activity risks, and it goes into more data. We'd have to be here all night. But I think this picture shows you, how we rank, how we're doing, moving forward. But this next one is a newer addition to the county rankings, which is looking at gaps. So what they looked at is the fact that most of Vermont's 300 excess deaths, those that really shouldn't be happening, tend to occur in counties with higher populations, such as Rutland. So you can see we have a bigger black dot on our county. However, some counties with smaller populations also have disproportionate share of avoidable lives lost. And so they're picking on Orleans County here. So what this is saying is that there is certainly work to do. And when we look at that work to do, it's making sure that we are providing and creating equity. This is a newer term that's out there in population health and looking at the health of people. And as you can see, the difference here is if we give everybody the same stool, not everybody's going to have, reach the same potential. Sometimes we need to give people an extra boost to get them to be as healthy as we'd like them to be. So in looking at that, that's one of the things that the Bell's Health Trust and the Blueprint is doing, is how do we provide the extra boost to those people who need it? So I've been trying to quantify it in some way, what it would look like if we tried to look at some of the programs that are offered here. I hesitate to show this slide because I know it's not inclusive of absolutely everything we have in Rutland. But if we were to look at tobacco use programs, diet and exercise, alcohol and drug use, and sexual activity, and just name some of the programs, some of the coalitions, and the efforts that are going on, you can see it's rather extensive. I wanted to highlight those things that the Bell's Health Trust is funding. They are in red, so you can see how we are supporting different initiatives across those areas of the determinants of health. And then the blue represents where the Blueprint is coming in and adding additional programs as well. So this is health behaviors. If we move on to socio and economic areas and those programs, again, you can see a lot of programs in red that the Bell's Health Trust has been funding or currently funding, and then some of our Blueprint programs are in the blue. They're pretty light. We do some work in homes in trying to improve the internal environment for kids and adults who are struggling with asthma. So moving along, clinical care. Of course, we can't forget clinical care because we want to make sure it is accessible and of high quality. And so there's a number of things that the Blueprint for Health is doing in our community to make sure that healthcare is accessible and at a high quality level. Again, I'm highlighting that Recovery House and our partners at CSJ have expanded the spoke programming dramatically in the last couple of years. And we thank them for that work because, as we all know, it's very needed. Moving to the next category, environment, not so much here, but certainly there are some programs that we know we're focusing on homes that could be improved for those people who are struggling with some respiratory illnesses. And in every community health needs assessment, we do hear transportation tends to be a barrier for some people having access to care and getting to their appointments. So certainly there's work to be done, but I hope this provides to you a snapshot of how important it is that we have a broad kind of cohort of programs to help those in our community who need that extra boost to be as healthy as we'd like them to be. So thank you. Yes.
Okay, we're receiving a lot of terrific information here tonight. So next up, I'd like to introduce Sue Daly, who is a drug and alcohol counselor at the Rutland Regional Medical Center. Sue.
Hi, everybody. My name is Sue Daly, and I am currently working in the emergency room at the Rutland Hospital doing the ESPERT program, which stands for Screening, Brief Interventions, and Referral for Treatment. We try to screen every person that comes into the ER. We don't always get to everyone, but we also work with our doctors or the nurses, and they happen to come over and say, Sue, you might want to go into room 16 because something is going on. So our program started in 2014. As of today, we've screened about 12,000 people that come in. We screen people from the age of 18 and over. We do education. Sometimes we do brief interventions, meaning if you kind of score high on the alcohol or drug use, we give them information that they need. Since I've been there, I've had quite a few people that come in and they want to get help. But they come in saying, oh, I've got abdominal pain. When I go in to do the screening, they go, well, you know, my parents sent me here because I'm drinking way too much, and that's why they think my stomach hurts. So we have all different avenues that we can use with people when we go into the rooms. And this is federally and state funded. It's been a free program for the last 2 years. Our grant runs out in October, and hopefully we're going to remain there because my belief is that we've made an impact at the hospital because, you know, I've seen other people and I know people that, you know, years ago they went there and when they were leaving they got handed a brochure saying, you need to call like quitting time or something. What we do is if someone needs a referral to treatment, we will call the treatment center, and we owe a lot to Serenity House and to Quitting Time because they're our number one people that we refer people to, and thank God that we have the relationship because it's not easy sometimes getting people to treatment. And we have them in the ER and they're hot and they're ready to go. And if I tell them, well, I can't get you in for 3 weeks, you kind of lose them. But the other thing that our program affords us to do is if I can't get them in for a couple of weeks, I do what we call a brief treatment, and that means I can meet with them in my office. We can meet with them 10 to 12 times before we can get them into treatment. So it keeps them on task. We have served a lot of people. We have a 91% delivery rate, meaning that 91% of the people that we have seen that need treatment have gotten it. And like I said, it's the people that are sitting here that help us to do that. Also, Tracy at Turning Point has been very good. We call Turning Point if somebody might think they've got a little bit of a problem. We'll call her. She gets a training coach that gets a hold of the people because left to their own device, they aren't going to do it. You know, people go, yeah, Sue, I'll do this. And they leave the paper on the bed when they leave. So we follow through. If they have to go up on a floor, if they have a medical as well as drug and alcohol, we will talk to the social worker on the floor. We'll go up, call a treatment center, and facilitate those calls that get these people into treatment. I know very well that left to your own device when you're not feeling good or you're detoxing, you're not going to do it. So I think that's why our rate is so high, is that we'll follow you, you know. We've had some very good people get into treatment. My thought is everybody's a good person. They only took, they took a left-hand turn instead of going straight. I happened to be out someplace one night and ran into 4 people that we had screened in the hospital that we had referred to treatment, and they were all still sober 4 months later. So the program is effective. I think that we also, in turn, help the doctors sometimes because They're very busy. And sometimes we've gone into a room before the doctor gets there, and I can come out and I can say to the doctor, this person needs to get inpatient treatment. Well, what are you going to do? We're going to call Serenity House, we'll talk to the people down there and get them in. So it kind of helps the doctor in that, okay, we'll do the blood work or whatever needs to be done. We work as a team. I have a partner that I work with, co-worker Michelle Burnham, and we run at the hospital from 7 in the morning until 10 at night. So the other thing that we had to put in, because people come in later on, is each doctor has a referral form. If somebody comes in at 1 o'clock in the morning and they need help, they will fill their name and let us know so that we can, one, call the person if they've left the ER, or most of the times they're spending the night because they're too intoxicated or too high to leave. I think this program all over the U.S. has been very effective. I know it's been effective in Rutland. We do not have what we sometimes call frequent flyers who were coming because I got a toothache or whatever. I spoke with the head doctor of the ER, Todd Gregory, and I believe he said our opioid use has gone down 15% going out of the ER. So I think that everybody is getting on board with this. I think the good thing is, with the Vivitrol, we're all learning about it. And I love to see people trying that. So we've had some instances where people want to be on Vivitrol. We call Westridge. So we all work together, which makes it a lot easier. I know who to call to get what I need for somebody. Thank God. And I just think in Rutland community that we have enough meetings that we all get to sit and visit. And it's like, geez, I didn't know you did that. We don't know everything that's out. I don't, anyways. I should speak for myself. I don't know everything that's out there. But when I'm at a meeting, I can pick that up. So, again, I will say, my belief is at the hospital, the expert program has been very effective, but we can't do it without these other people. There's sick people trying to get well. And to me, that's my job. I will fight for anybody, 100%, to help them get better because that's what they deserve. And our communities are much better because of that. I've seen girls go home and be mothers to their children. They were in DCF custody. They are not any longer. That's what, to me, makes my job worthwhile. Because a lot of times you don't see a lot of winners. But you see one and it makes it worthwhile. So I commend anybody trying to get and stay sober and clean. Sometimes it's not hard. Sometimes it's not easy. But the end result, if you do it, and when you do it, you got endless possibilities. Really. So I would like to thank Dale for inviting us to this forum and everybody that I'm sitting with. And thank you, Dale.
You're welcome. Well, thank you very much. So finally tonight, I would like to introduce a speaker who was up previously, the CEO of Recovery House, Dale Robb. Dale.
Thank you. Listening to these speakers that we've had, there must be 10,000 things that I want to say. You may be here a while. I'm just kidding, but you guys know that if I'm talking about Recovery House, I can get going. And that's a good thing. I'm glad for that. I'm glad that I can do that. So now I get to tell you the services that Recovery House offers, and that can be all day. But I'm going to do it quickly, and then I'm going to talk about a couple of other things. Recovery House Recovery House started around 45 years ago, really from 12-step programming from the Alcoholics Anonymous community. They thought that, gee, maybe people in the Rutland County area around Vermont might have a problem with substances. And that was 45 years ago, and they were right. And it's grown from, I think, originally 2 beds with Alcoholics Anonymous bringing in meals to a 24-bed residential treatment facility that is amongst the best in New England. That's what I say. So we have a residential treatment facility, and people come in, and we work with them to try to put their life back together sufficiently for them to be able to leave in a couple of weeks and participate in more treatment when they go home and organize themselves again so that they're doing the things that they need to do to be able to stay sober. And I think probably the main message that we deliver at Recovery House, and we have a little saying for it, we say that the money's in the mirror. The only way you're going to make any profit in trying to advance in getting sober is to ask this question: what is it about me? The reason you have to ask that question is because you're responsible for how you feel and how you respond. And there's only one person in this world that you're ever going to be able to change, and that's yourself. You can't change other people. So when I'm upset about someone else, about something else, the only place that I can make any money toward my sobriety is to ask the question, what is it about me that this situation impacts me in this way? And we spend quite a bit of time trying to help people understand that and see that that is a view that will help them as in the process of trying to make sufficient changes in their own life so they no longer feel that it's necessary to inject or drink or snort or any number of ways a foreign substance to feel okay. That's what we're trying to do down there. Those people live with us for a period of time, and that's what residential treatment becomes. We also offer transitional living, which means that sometimes a person goes through a few weeks of treatment, and maybe before they came to treatment, they didn't have a home. Or maybe they were couch surfing, and that's a lot more common than you might think. And it probably isn't going to be a good idea to have those people return to couch surfing and anticipate that they're going to be able to stay clean and sober. And so we have some beds for people to stay in, and we don't have many, and we can't take very many people, but those people that we can take usually live under those circumstances anywhere from 3 to 6 months and try to put their life back together. They enter this kind of living, and the first goal that they have when they go to Grace House, the first goal is to get out of Grace House because you want to reestablish your independent living skills. So we help people move through that activity. We also saw a need in the Rutland County area for people who were involved with medication-assisted therapy, which means that, more than likely means they are using opiates and they are using a medication to help them stay away from opiates. And we thought there was a need for the provision of that service through a physician who plays a role, not a large role, but a role, and services for a person to participate in while they are under the care of the physician. But that's an expensive proposition, and we didn't really know how we could do it, and so we turned to the Bose Health Trust Fund, and we approached them asking for startup funding. And they had participated in ventures with us in the past, and those ventures had gone generally pretty well. And so they were willing to grant us some startup funding to provide that service in the community, and they had they offered us money for multiple years if we need it, but by the nature of that business, after 1 year, we had received the funding that we needed and were able to keep that operation going. But you should note that the way that we're able to do that is the Vermont Blueprint for Health provides us with some funding to pay the people who provide the counseling services and the nursing services, and we make that service available evenings. There are nights when, if you went to Grace House, the clinical supervisor, Chad, who's here tonight, is there till 7 o'clock at night, and he's seeing clients because that's when clients can be seen. So that's why we're there at that time of night. It's not, well, it's probably not Chad's preference, but that's when people are available, and so that's when the service has to be there. So we provide those things, and we have one other main service that we provide, and that is the Rutland County Public Inebriate Program. That's an entity that is in existence by statute, by law. And this is a way for people who have a substance abuse related issue with law enforcement to not experience going to jail as a consequence of having what we believe is a disease. And that is, the disease is sometimes worse than others. And if a person was to receive to be stopped and accused of driving while intoxicated, they may be able to come and have a safe bed with us overnight, and we will monitor them through the evening, and we will talk to them. We will try to connect them to the services that they could possibly benefit from if they are interested in doing that, and that's always a big if. Lots of times, the first time an individual comes into public inebriate, they tell us, well, that's a once-in-a-lifetime thing. I never do that. This night it was my birthday, and we had a party, and they made me drink shots. And okay, but if it's the fourth time they've been to our program in the last month, the argument starts to change a little bit. And from time to time, someone will engage in services through that program. And those are the programs that we provide. But let me tell you, it is so much more than that. We are a part of a community. And the people that are here on the stage tonight, I mean, what would we do if people came to substance abuse treatment and 2 weeks later it was, okay, see ya, off you go. And there was no place for us to say to them, all right, you got to keep this thing going. You've gotten a little clean time under your belt, but you know, it's not going to be a piece of cake, and you need to have a place to go so that you can get some more help. And we can refer them to some place like the Evergreen Substance Abuse Treatment Center that Clay runs, where they could participate in any of those programs that Clay talked about. Or if they're a person who has chosen medication-assisted therapy as a way of staying sober, and it works for people, it does. If they're participating in that type of treatment, they may need to have someone to help them with the discipline of taking a dose on a daily basis. Or maybe they need a highly controlled substance like methadone. The only place you're going to get that is if you go and see Faith at the Westridge Clinic. It's all part of a community. If we don't have Sue Daly, how are we going to know about people who go through the hospital and are there, to one extent or another, they're there because they have a drug or an alcohol problem. It may be masked by something else, but the core problem going on with this individual is substance abuse. And they get identified and offered assistance because of the work that Sue and Michelle do at the hospital with the emergency room people and the experts. Or if we have a residential treatment person at Serenity House and they get sick, a lot of times people just coming into substance abuse treatment, I have to watch this clock a little bit, guys. coming into substance abuse treatment really aren't very comfortable going to the hospital, and a lot of times people who are just coming off opiates going to a hospital see an opportunity. But we at Serenity House can call the hospital and we can ask for what are called the experts, the screening, brief intervention, and referral to treatment people, and that's Sue and Michelle, and they will come down to the emergency room and meet us there. And we'll say, Sue, this is John. He's coming up from Serenity House. He's been having some problems with, and he's getting treatment for opiate addiction and would like to have you around a little bit because he might need a little help while he's here. And that is just, it's the difference between night and day with our experience with the hospital. How are we going to fund a medication-assisted therapy operation if we don't have initial money from Sarah at the Bose Health Trust Fund or from the Blueprint for Health that the hospital provides to us? How are we going to do that? The truth is, guys, we're not. And we're not because we can't. The funding model doesn't work. The model falls apart. But because we are in a community and we have community partners, we can do it. We have our other Sarah, who in my mind is a tremendously valuable person in this community, and she does have some specialization in prevention. Of course, I'm from treatment world and she's from prevention world, so maybe she'll put me out of a job, and that'll be a good thing if she can do that. But I'm going to tell you something about treatment. Treatment is prevention. There's absolutely no question about it. If you think about the impact that getting sober can have on somebody's children, that is prevention. And I know this to be true. Treatment is prevention, and it is probably the most effective form of prevention that you will ever find. So, we all operate together, and we have to. I really enjoyed what I heard tonight about social determinants, and it kind of reminded me of a story that I just want to share. And I call this story Rat Park. There is, well, the research has been around for a long time, but I teach introduction to psychology students with an example, and the example is, if you have a cage and you have two sources of water going into that cage, and one of those sources is water that is laced with heroin, and I may be taking some liberties with the research, so let's call this a paraphrase. One of these bottles of water is laced with heroin, and one of them has regular drinking water in it. What Mr. Rat in that cage will most likely do is he will attack the heroin water bottle and drink it until he dies. That's the power of that addiction. But there's a second experiment. Someone came along and said, well, okay, that's interesting, and it's true, it's been replicated and done again and again, but they're in a cage. Well, how much fun's being in a cage? What if it was a different setting? What if the cage was different? And so he built a big cage, and he put grass in there, and he put dirt in there, and he put little balls that the rats could roll around in there, and he put tree bark and other rats and things that rats like in that cage. And then he put those two water bottles up there. And one of those water bottles was laced with heroin, and one of them had regular drinking water in it. And lo and behold, when the environment was a little better, the rats didn't go after the heroin. Now, what's that tell you? Well, when we take a broader view of substance abuse in our world, it says that social determinants have a lot to do with where people end up, and they have a lot to do with rates of addiction and the manifestation of epidemics like the opioid epidemic that we've experienced here. And having people looking at this problem in that way and trying to fashion interventions and do work to improve the area that we all come from helps us. So I really appreciate that and think that's a wonderful approach. So, all right, I talked quite a bit. And I'm going to be done, but I don't want to. But I'm going to be done. I do want to thank the board of, I was thanked several times by people here, and really I appreciate that very much. But it's Recovery House, and that means that it's the board of directors of Recovery House. And there are some members of the Recovery House board of directors here tonight. There's Dick Keene, there's Mary Byrne, there's Jeff McKee, there's Dave Allaire, and I think regrets from the others. Did I miss a board of director person? Because that would not be good for me. That would not be good for me. And I want to thank the people who are here from other agencies. In particular, I think I see somebody from Sanctuary House. And I want to give Sanctuary House a little bit of a way to go, too. We're tied to the Sanctuary House organization, which is an offender reentry program that uses a building that Recovery House owns but leases out. And the building really, it didn't look all that good. The hedges weren't cut, the lawn wasn't mowed, and it just didn't look that good. And I'll tell you that since this offender reentry program has gone in there, and Sanctuary House has been running programming in that building, man, things look a lot better.
Thanks, Dale.
And I really appreciate that very much. So, I mean, I could have thank yous for a lot of people, and I do appreciate everything that all of you guys do. And so with that, I am done.
Okay, well, thank you very much. So we just have a couple of other things on the docket tonight. At this point, I thought we might open it up to questions. If anyone from the audience has a question for any of our panelists, please feel free. Just raise your hand. I'll call on you, and we'll go from there. Does anybody have anything that they would like to either ask a question or have or make a statement or anything about our program tonight? Yes, please.
For the woman who shared about Suboxone maintenance and Vivitrol and methadone, you said that there was like expectations for the people who do Suboxone, and then you said there's 5 people on Vivitrol. Do people on Vivitrol graduate from those programs the same way that people on Suboxone do? Like on to
So the administration of Vivitrol is fairly new for us, and the 5 people are on it have just started, I would say, within the last 4 months. So those folks are still expected to come to the center and do groups and participate in counseling, urine drug screens, and you know, the vision is that they do graduate and be successful in their recovery.
Thank you.
You're welcome.
Thank you very much. Thank you. Please.
Also about the Vivitrol, I've heard the cost of that is very high. So do you offer assistance with that? Does the hospital offer assistance with that, or the hospital?
Insurances are paying for it with the folks that we have currently.
Okay. Anyone else have anything for our panelists? Yes, please.
We have a question. With Maple Leaf being shut down, is there anything being done to cut down the wait list for inpatient
So the question was, with Maple Leaf Farm, which was one of only 3 treatment centers in Vermont, residential treatment centers, closing down, is anything being done to try to make up for bed shortages? And the answer to that question is yes, there are things being done. Now there are only 2 organizations that provide residential treatment beds. One of them is headquartered over in Bradford, Vermont. The name of that treatment center is Valley Vista. And Valley Vista is offering some additional treatment beds at their facility in Bradford, a very few. And they are also offering treatment beds, hopefully within the next 4 to 6 weeks, in Virgins. So that's the effort that Valley Vista is making. Recovery House is also responding to the situation. What we are doing is we are temporarily using our Grace House beds here in Rutland on Washington Street as treatment beds. And we will move people into that building not by taking the current residents and having them move out any quicker. We will do it by a process of attrition. As beds open up, we will use those beds as treatment beds. And that will help fill some of the space that was created with Maple Leaf Farm closing their doors. Does that answer your question?
Yeah.
Okay, thank you.
All right. Is there anyone else who would like? Please.
I'm an addict in recovery. I've been through about 3 or 4 of those programs a couple times. I've been to Westridge, I've been to Serenity House a couple times. I've tried the IOP a couple times through Evergreen. I guess I didn't take them seriously or whatever before. I wasn't working in a program. But they've happily helped me out multiple times, accept me back. It really is true, like what they say, teach you about, like, you get out of it what you put into it. I think I can only really speak on the Rutland area because that's where I'm from. I think especially over like the last 5 years, I think this community has done a great job focusing on recovery. I'm back in Westridge, I'm working a program, I'm a resident at Grace House. And Dale and Chad and the other staff members there, I think have really given me a good foundation and direction to go down. The way I'm kind of looking at it, there's mixed people at Grace House, they have mixed opinions on it, on how they're treating us. I think they're treating us very fairly. I'm kind of looking at it and like, if I can get out, our goal is to get a place of our own and a job and everything. I'm kind of looking at it as if I can get out and get my own place, then maybe I can help another addict out by giving him a bed at Grace House or something. I saw on the news that something about New Hampshire getting like a federal loan or something, or a federal grant for like $2 million or something. I didn't know what the money situation was with Vermont, and maybe getting Serenity House or Valley Vista to take over the Maple Leaf Center. I know it's expensive, but if we could get like grant money to help get Maple Leaf going.
Go ahead.
So, thank you for that. It's a very good question.
It is a very good question.
So, the question was, is there any, to my knowledge, is there any movement or grant money available that would allow some organization to take over the treatment center that closed? The name of it was Maple Leaf Farms, and keep it open? I think that the current strategy being used by the Vermont Department of Health, Alcohol and Drug Abuse Programming, and the existing residential facilities is to find other ways to build the same capacity. It seems like it is more economical to expand the capacity of the existing organizations than to try to do anything else at this point in time. That's the impression that I have of the situation, and that is the way that Recovery House is operating in the current environment. That's what our strategy is, but I will tell you that I am confident that in a relatively short period of time, we will have replaced those treatment beds in the state of Vermont. I don't think it's going to take that long, and I think we will have those beds up and going quickly. And one of the things we need to do is thank the Vermont Department of Health, the Office of Alcohol and Drug Abuse Programming, the Agency of Human Services, and all of the entities that are helping us trying to address that issue. So thank you for that question. Good question.
Can I add a little more?
Sure.
So, no, it's a very valid question. Through alcohol and drug abuse programs, we actually have applied for some federal funding, but it's going to look at for opiate prevention, treatment, and education. And it's going to specifically look more at the spoke providers and hub providers, so not necessarily the residential treatment, but trying to expand so we can have more, which are nurse and mid-level providers, being able to provide medication-assisted treatment. So we're not just focusing that only a doctor can prescribe something, we're expanding our pool and our catchment area. And there's always opportunities for other agencies to actually apply and become what's considered a designated agency, because there's been a discussion of that. There are some pockets of the state that we have great agencies that are not getting substance abuse dollars at this point. And our director readily says, anybody who would like to take on and actually ask for that is willing, can apply for it. We necessarily don't have like a pool of money behind us, but we can try to figure this out. So we've been trying different approaches to wrap around that, but we have potentially some funding that will come in looking at more opiate work.
Okay, very good. Great question. Yes, sir.
Clay, you said really briefly at the beginning of your comments that you have more programs than staff. Can you comment a little bit about how that looks at Evergreen and what you see are kind of the barriers?
Sure. The substance abuse treatment is changing a lot ever since I've been working in the field. The opiate epidemic, that's, in the last decade, that's been a major thing of focus. It's good for us not to forget that alcohol is still one of the biggest abused substances, along with marijuana, cocaine, the other substances that are used. So we're still getting a lot of those folks coming into treatment. But one thing that I'm noticing with the opiate epidemic, it seems to be grabbing onto people quicker. And what I mean by that, back in the 80s and 90s, alcohol was probably the biggest focus, but alcohol is a little slower progressing disease. So folks that were coming into treatment were quite often a little older, in their 30s, 40s, 50s, and so forth, but they had a fairly functional life up until then, where they had families, they had jobs, and that sort of thing. With the heroin epidemic, it's really attacking young people terribly. And the folks that we're getting into treatment now, it's almost like we're habilitating rather than rehabilitating. Because a lot of these folks that are coming in, they've never had a successful adult life because the opiate addiction grabbed them at such a young age. So that's really a difference in the way the treatment has been, and that's certainly a challenge that we're facing. As far as barriers, it changes all the time. And the one thing that I do believe in, though, is tearing down the barriers, making it as easy as possible for people to get into treatment. Because I know when someone makes that one decision, today they might be ready to go, but an hour from now or tomorrow or a week, they may not be. So tearing down as many barriers as possible is one of the things I've worked on a lot. One of the things that I do at Evergreen is if someone's been to Serenity House, they've had a complete assessment. So what we do is we don't think we need to redo the assessment and make an appointment 2 weeks down the road to do an assessment and blah, blah, blah. We just take them right into treatment, and Dale's staff sends us a copy of the assessment they had there, and then we start them right in treatment, so there's no break in treatment. So hopefully that answered your questions, but continually looking at what the barriers are, because it changes week to week.
Okay. Anyone else would like to ask a question? Alrighty. Well, thank you. There's one final piece of business that we wanted to take care of tonight, and I'm going to ask Dale to come up. We want to present our Community Partners Award, and a very special award that we're about to give out. Thank you.
Thank you, David. So this is a really nice thing to be able to do and something that I'm going to enjoy doing. I've talked a lot about the fact that we as treatment entities are part of a community, just in the same way that people recovering need to be part of a community too. People seek social connectedness. We are basically a herd animal. Some guy told me 30 years ago, geez and crow, you got to join the herd. And he was right. You did have to join the herd. So without the help and the support of the other agencies that we work with, we can't do our job. And there's one particular area that we feel has contributed greatly and in a different way in the last really few years. We think that the emergency department at the Rutland Regional Medical Center has changed some of the way that we interact with them and some of the approaches that they use as the recognition of people's medical needs if they are also suffering from the disease of addiction has become a better defined and more recognized area. And the Rutland Regional Medical Center in their emergency department has also added the screening, brief intervention, and referral to treatment services, and they are just invaluable to us. I hear stories about years ago when a person would come to Serenity House and sort of magically slip and fall and have to go to the emergency room, and they would bring back a lot of Vicodin or Percocet or some other type of an opiate medication. And that upset people. It upset us. It just we didn't have a way to make the addressing of medical needs work with a person who was probably constrained in the ability to take various medications because of addiction. And that's something that we just feel like the hospital has done so much to help us out in working with the population that we do. And so, Recovery House would like to give this Community Partner Award to the Rutland Regional Medical Center Emergency Department. Recovery House thanks you for delivering quality care to those clients suffering from the disease of addiction, February 2017. And Dr. Sean Toussaint is here to accept this.
Hey.
To the microphone.
All right. Well, I have nothing prepared. That should be it. No, I really have to thank Sue and Michelle and really Todd Gregory, the head of the emergency department. I think we've made a concerted effort, to do our part to help with addiction and really with prevention as well. Because I was actually just thinking about it here today. And it was the first time I really thought about it, is that when someone comes in, as Sue kind of mentioned, kind of hot, it is an emergency. And we've kind of taken that mentality to kind of treat it as such, and hopefully it's paying off. And again, thank you so much. This is very nice. Thank you.
So that is the end of our program tonight. I want to thank our participants and our panelists for their presentations very much. Thank you all for coming and being a part of our conversation on this very important topic here in Rutland County and throughout the country. So thank you. Have a great night.